A warm welcome to all participants around the world to today's webinar. We are delighted you could join us for the first in a year-long series of webinars organized by the European Network of Safety and Health Professional Organizations, or ENSHPO. You may notice I am not Alison Van Keulen as advertised, who is sadly unwell today, and we wish her a speedy recovery. My name is Marcel Leroux. I'm a Strategic Engagement Manager at the Institution of Occupational Safety and Health, or IOSH, who is, as proud members of ENSHPO, are pleased to be hosting today's session. I will be your moderator for the session, and I'll be joined by a fantastic panel of guest speakers representing our ENSHPO network, who I'll introduce you to shortly. Today's webinar will be an hour long. We will hear from each speaker, followed by a period for questions and answers. As you hear from our speakers today, please do utilize the Zoom question box to ask any questions, and we will answer as many as we can at the end. First, though, for those of you who are new to ENSHPO, I wanted to take this opportunity to introduce the network. ENSHPO was established in 2001 under the umbrella of the European Agency of Health and Safety at Work, or EUSHA. We engage with decision makers and regulators at a European level, fostering cooperation between European safety and health organizations. We strive to be the leading voice of environmental health and safety professionals in Europe to promote a safer, healthier world of work. You can find out more on our website at www.enshpo.eu. ENSHPO members are representative of EHS organizations across the continent and bring together learnings, innovations, and experiences from their networks. And it's these innovations and experiences we will be hearing about today. This webinar focuses on the emerging trends in safety and health training and will give us an insight into different approaches and considerations. Our world of health and safety is always changing. It is being shaped by global trends with changes in working practices, workplace demographics, and technology, as well as responses to the COVID-19 pandemic. As a consequence, EHS professionals feel the pull of change also, with more than solely technical knowledge needed to reach businesses and workers and implement interventions to create a safer world of work. EHS managers must look to innovation, flexibility, and soft skills in equal measure. When it comes to training the principles of good OSH, to see the results, we must focus not only on what results are delivered, but how those results are obtained. So, to our panel, I'm delighted to welcome Mareja Rifa, ENSHPO board member and vice president of IEPSOL, Rudolf Getzi, OSH manager of MMA, Hungarian OSH Academy, and Francesco Santi, president of AIAS. And to kick us off, I would like to hand you over to Rudolf.
Thank you, Marcel, and welcome, dear guests, and good morning, good afternoon, and good evening. Around from the globe, I can see that you came to visit us. It's a very, very big honor to me. And let me share my screen. All right. Okay. So as you can see, to today's session, we are going to talk about the European emerging trends in health and safety trainings. And actually, in Hungary, we are really much mirroring and following the European trends. And we have several different education levels to address how to get onto the market and be a safety engineer or a safety technician. So today, what I'm going to talk about is how to provide participants with professional knowledge, skills, and competencies via newly designed short cycle tertiary OSH education in Hungary. As it's being said, I'm Rudolf Gates. I'm the president of MMA, and MMA is not for fighting, but it's in Hungarian, the OSH Academy, and I'm also for 10 years a lecturer at the Budapest Technical University. As you can see on the bottom, this OSH Academy, established in 2022. So we are a very young organization, very ambitious, and it means that we are really would like to bring a big change and a shift in how to handle occupational health and safety in Hungary. Just to jog our memories a little bit, I would like to introduce you this international system where you could see from 0 to 7 how it is coming. It's starting from the early childhood education, ending with the master's or equivalent level from 0 to 7. What I am going to focus today, it's going to be the ICD-4, the post-secondary non-tertiary education, and on the ISET-5, which is the short cycle tertiary education. The ISET-4 is a post-secondary non-tertiary education, and it's about to provide learning experiences building on the secondary education. This is up to prepare for labor market entry, as well as entering into the tertiary education. These programs at level 4, or let's say post-secondary non-tertiary education, are typically designed to provide individuals who completed the level 3 with non-tertiary qualifications required for progression to tertiary education, or for employment when the IC level 3 qualifications do not grant such access. This is typically happens in Hungary when anybody wants to enter and start to be an OSH professional. They definitely need to go through the level 3 and after apply to a level 4 program to become a safety technician as an entry level. On the number 5, the ISET number 5, this short cycle tertiary education, this is something which sort of didn't exist in the Hungarian education system. And this is about such programs which are often designed to provide participants with professional knowledge, skills, and competencies. Typically, they are more focused on practice and more occupational specific. And this is really preparing the students to enter the labor market with a higher level qualification. However, these programs may also provide, again, a pathway to other tertiary education programs. Entry into these ICED level 5 programs requires the successful completion of ISET level 3 or level 4 with access to the tertiary education. Okay, so this is about a little bit refreshing our memories about the system. The present situation on occupational safety and health education in Hungary, it's a very much simplified picture, so I must say apologies for everyone, but really in this audience and within this short time, I had to do this simplification. So I would say that this level 4 existing post-secondary non-tertiary education, we call it so-called OSH technician. This is giving an authorization to do almost everything, but limited to below 1,000 employees. And this is not going to make you eligible to be licensed as OSH expert. But basically, what I would say that this is the real fighters of the safety guys who go to the companies and establishing legal compliances and really fighting on the field day to day. Also, we have an ISET 6 level, which is a bachelor's or equivalent level education. This also exists in Hungary for a long time now. It is an OSH engineer. This is really much sort of you can do, or you're going to be authorized to do every type of occupational health and safety professional activities. And there is no more limit on the number of employees within the companies. And you also may be licensed as OSH expert if you are going through a screening process and you have the right background and right CV, so you can apply to be an OSH expert with that. Both education schemes are focusing on the OSH legislation. The OSH legislation in Hungary, you should understand that it's equal to the European Union system. We really made a big effort during the years since and even before we joined the European Union to make sure that our legal system and even the standards are according to the European level. So the main difference in between these two education, let's say the level 4 and level 6, is the depth. It means that both education designed on compliance, on occupational health and safety compliance, but of course on the 2 years course versus the 240 hours course is much more detailed and much more deeper. In 2021, there has been a study made amongst national occupational safety and health managers at multinational, so let's say big companies over a certain amount of turnover and over a certain amount of people, typically about minimum 500 people. And actually, almost half of these national occupational safety and health managers said that they are often skipped from key business decisions with high occupational safety and health impacts. This is something alarming because in Hungary, we definitely have these managers who are leading the occupational health and safety at these large companies are really key players, and even them saying that they often skipped from the key business decisions, and this is alarming. And the existing educations are sort of missing to foster the deeper understanding of the occupational safety and health systems, like ISO 45001 today we call it, the understanding the safety culture, then all the risk assessment models like the understanding the HAZOP, the FMEA, low pass studies, and so on, and the dealing with human factors. Importantly, focusing some or missing the focus from some soft skills. You need to be a good influencer to sell occupational health and safety to the business on an effective way via sharpening your influencing skills, understanding the minimum economical aspects, the newest IT solutions, and so on. MMA has designed an ISET 5 program, which is in between the 4 and the 6. It's a short cycle tertiary education program, but due to the fact that it's based on a ISET number 4, this education program is much more broadly available, really for the fighters on the field to learn about these skills and these systematic mindset and techniques on occupational health and safety beyond the compliance stuff. This program is today submitted for a final governmental approval. So we are putting our hands together and pray for God to get this done, because it's something which is going to fill a huge gap in the Hungarian education system, MMA believes. So, and this is why I would like to introduce this to you. Just the key highlights or a few highlights from the program, because this is, of course, it's a much broader program, and I'm here if you are interested. I'm going to ask my colleagues to translate even the whole program if it's needed, and you would like to use some of the information from them. But you can see that basically we are aiming certain skills and capabilities. We are aiming to build up some knowledge. We want people to interpret and use the occupational health and safety risk management tools, understand sustainability, and even understanding other strategic elements of the employers to be able and adjust the system. For that, we need definitely the PDCA model, risks and possibilities, management techniques, and so on. We would like to nurture with certain attitudes and expected behavior of the people. So you can see here we are aiming for motivated people, motivated to implement new solutions. On the other side, we also know that beyond the hardware, beyond the compliance and the legal requirements, we definitely need to understand human factor in the labor safety area, the behavior, the motivation, even in the behavior going further and understand the cognitive, psychological, emotional responses. So these things are really helping us to sharpen our hard skills and soft skills and make our people more competent. Preparing and support the leaders to take decisions on labor safety. If you remember well, I was mentioning that many of us are forgotten about a big business before a business decision to prepare, and they are forgetting to invite us. It's not a coincidence. It's very much like because during the years and decades, we may have sent a bad message that we don't understand business, we don't understand economical correlations, and this is something which we would like to remedy and we would like to correct. Also on the skills and capacities, we need to make sure that that wherever an investment or any developments are happening, it's very well designed, and we also have a broad knowledge on the other businesses and other business departments, how they work together. This is also included in the program. And because I'm sure that I'm going to have my time is getting over soon, I would like to thank you for your attention. And then, as I was telling you before, I'm here and available. You can also see my access details, my email, even my mobile phone, and I'm more than glad to share these insights with you in some more details. So I would like to thanks for the opportunity. And Marcel, I would like to turn back the speech to you. So thank you very much.
Thank you, Rudolf. You raised some great points, and we're wishing you all the best as the scheme progresses. As a reminder to our audience, you can ask questions in the question box, which will be directed to our speakers towards the end of the session. I would now like to introduce our second speaker, Francesco Santi.
Thank you, Marcel, and thank you, Rudolf, for the very interesting presentation we had before. I share my screen, presentation. Is it okay? Everybody seeing? Okay. Okay, this is the issue I will talk about, that new technologies applied to health, safety, and sustainability. As this is the presentation index where we talk about who we are, why the problem, which is we are talking about, a new approach that we think that is required, the technology applied to health, safety, the environment, some critical still open issues, and a call to action for everybody. Who we are? We are IOSH, that is the first and most important Italian association of professionals and companies working on safety, health, and sustainability. I am an engineer and I worked 20 years as manager in multinational companies. Now, since 15 years, I am an entrepreneur in biological risk, Legionella risk, and or quality certification. Moreover, I'm a president of IS since 3 years. So the question is vision zero in safety, so no incident, no accident to our people, and vision zero in environment is something that we can really have as target for our organization, or are just say slogans. If we look to the effect of in Italy, for example, and things that in many countries are more or less the same, we see that the fatal injuries since 1917 up to a couple of years ago was strongly decreasing, and this is good, of course, as is our target. But in last 15 years, 20 years, the situation is not really changed a lot. We have a fluctuation around 1,000 people dead at work per year. Of course, we have to talk about the data collection because we collect data even on some different issues from different countries, but this is a real problem. Moreover, in last year, during the pandemic, at the end of pandemic period, our government put a lot of money on the building business to increase the safety of the business of the building and to decrease the energy consume of the buildings. The result was that a lot of people that were working before in different aspects of the activity became workers in building business without training, without safety training, especially without experience. As a result, that in last year, we have a strong increase in fatal injuries. So why I say this? Because in ENSHPO and in IOSH, of course, we think that we need a new approach to health, safety, sustainability that is not only a mandatory approach with laws, but we need a lot of soft skills and skills, as Rudolf said before. Of course, communication is really important, but we have to work on decision data-based, not on sentiment, not on the last news on social network and so on. We need to rely on experience and knowledge, and we need to work with our stakeholders all together, because the problem is, as we say, an holistic approach to the problem. And we need a consistent data collection with analysis of miss and near miss. We need in environment, we do not want greenwashing, but even in safety, we can say we do not dirty outsourcing. It means that a company can easily get the zero injuries just making outsource the more dirty activities like maintenance or logistic and so on. So, and this is not a way to solve the problem, it's just putting it outside and say, I'm clean because I do not have this problem, but the problem is inside my companies. So another issue, of course, that we have and we think that is central is the human being is at the center. The behavior of the operator, of the employed, of the directors is the issue. And to change the behavior, we need to change the values of the people. And we needed to grant to the people a well-being, not only at work, but even in in any activity that we are involved. The new approach can rely on new technology. As we can see, new technologies can help in reaching the result of Vision Zero, both in safety and environment, in all the issues we talked before. For example, of course, new technology is the data collection requires new technologies, and as we can see later, artificial intelligence is one of the most important applications we can trust on to give decision makers a consistent database to rely on. Another example, we will talk now later, a little in the next slide, is artificial intelligence applied to personal protective equipment. Personal protective equipment, so helmet, glass, jacket, gloves, shoes, and others, can be all linked, can all use IoT technology to grant the effect. So we can have the detection of the presence of the helmet, of the glasses, of the gloves, when people is coming inside a determined area. We can, if the system require, if the PPE require it, can verify the maintenance, can verify the efficiency of the system if there is a problem of efficiency, but not only the correct use. For example, for the helmet, we do not want people in the department with the helmet linked to the belt. We want the helmet on the brain, on the head, and the IoT can grant it. Moreover, we can have a control of the location or the geolocation. But there are new improvements, for example, brain activity, some way monitored by the helmet itself. So the IoT applied to PPE is very, very important. And I show you a simple example of an IoT sensor that can be active on each vehicle on hazardous machinery and can be put on the helmet or the jacket of the operator to grant the protection, providing 360-degree protection for the worker in risk and hazardous environment. So if the vehicle is mobile device is dangerous for our operator, we can have different area, proximity and alert area, and the operator is advised that there is a guy walking or a system driving too near to him, and this can avoid a lot of injuries from pedestrian to vehicles. For example, this can be an application in logistics when the guy is walking, the operator on the vehicle can have a signal to reduce the speed or to stop. Moreover, if the system is linked to that to our information system, we can have even effect on granting that the correct people is in the correct area and does not go for a wrong reason in a dangerous area, and many other applications. Another application I can show you and is the new technology applied to indoor air quality. This kind of sensor is now available for, and they are really cost effective, with really cheap. We can, for example, in this sensor have the control of the total volatile organic compounds, CO2, particulate matter, humidity, and temperature, with the range really interesting. With this device, for example, in February 22, we have an application monitoring 20 position in a big company, and having a continuous data collection on carbon monoxide, ozone, nitrogen dioxide, total VOC, and others. And the result I can show now just a very short extraction from the report. We have all the data like carbon monoxide, dioxide, ozone, particulate matter, temperature, relative humidity. So an indoor air quality really good, but we have a problem with the total VOC. And this kind of monitoring was impossible without this kind of device. And the analysis forced the company to check why during these weeks we have formaldehyde and total VOC too high, and they discovered that it was a problem related to the cleaning procedure of the office and of the air distribution system. So cleaning, for one reason, we had a problem on the different reason. Another application I want to show you that is strictly linked to what we told before is the application of augmented reality and artificial intelligence to human work. We can think to an application linking together the possibility to have augmented reality with glasses or a connection with a simple device like mobile phone or tablet. And this can be useful in many applications because, as we know, employee safety, satisfaction, retention, and recruitment are becoming and increasing a challenge for all the organization. 80% of today's skilled labor force will be retired in 2030. And this can force the companies to have a short time frame to teach a lot of information that has been collected by experience. But the remote expert technology can provide instant access to remote workers who need access to experts while in the field. So we have the direct connection from the field, perhaps a not completely skilled operator, with the office where we have the more expert people. And the result is that artificial intelligence and augmented reality capability are becoming a solution for all the situations in which we need to teach a lot of technical information and to have a very dangerous situation. We can look it from the office and we can have a management really more effective. So there are some critical open issues about this, and this is that, as you see, with our, for example, with our watch, we are collecting data about our situation, like heart rate, like pressure, blood pressure, and so on. A lot of sensitive data collection, sensitive data are collected by the system, and this can have aspect to protection of this data. Another issue open is the relation with trade unions, because this system can be used for safety, for effectiveness, for maintenance, for training, but could be used even to control the efficacy, the real behavior of the operator. For example, how many times, how long does he stay in the restroom or in the coffee room, etc. And this, of course, is a problem that have to be faced. Last but not least, the relationship with lawmakers. New technology are much more faster than lawmakers. So there are a lot of situations in which the law are based on old technology and not on the new one. And so the companies cannot use these new devices because they are not possible to use because the law is too old. So this is our use. The rule of ENSHPO and our association of professionals is just this, to help people to use these new devices in the correct way and to solve problems like this one I told you before. So I would like to thank you, 3 companies that send me some information about it, for the PPI AME, for the ERQ sensor NOVAP, for augmented reality Casper Librestream. But I ask to everybody who is looking at this presentation to send us information if you have any kind of tentative of experiment of use of new technology applied to health, safety, and sustainability. Please send us, because we want to collect a database of new technology applied to this issue. So thank you very much for all the people listening to our presentation. Thank you to ENSHPO and to our colleague. And please, Marcel, is up to you now.
Thank you, Francesco, for an update on some fascinating technological advances in the world of OSH and training. I really appreciate that. Now, lastly, but by no means least, welcome to our third speaker, Mareja.
Hi, I'm going to share my screen. Can you see it? Yeah. Well, hello, thanks Marcel for your introductions. First, I would like to thank ENSHPO with the support of IOSH, the opportunity to be here, and congratulations for this spectacular initiative. My name is Mireia Rifà. I am vice chair of AEPSAL. AEPSAL is the Spanish Association of Health and Safety Professionals. We cover technicians and all health professionals too. And I am member of ENSHPO board since 4 years ago. My presentation will be about, and sorry, but I will have to switch off my camera because I have some problems with the connection. So just to not be kicked off of the Zoom, if you don't mind, I will cut off my video. If I can't, okay. Thank you, and sorry. My presentation will be about new methodologies to apply in health and safety training. It's for all well known that one of the pillars of the prevention culture is training and how to involve and engage our employees so that innovation and development of education methodologies coming from the education sectors should be adapted and incorporated in health and safety training. Adult training. The UNESCO Institute for Lifelong Learning will be launched its report number 5 called GRAIL 5, the Global Report of Adult Learning and Education, and it will be presented in Morocco at the end of this year. The concern of this report will be about automation, digitalization, and technological advance. And the problem that the onus is usually on workers to keep themselves up to date in these areas, both to find time to train and to carry out the training. And we are all aware when using new technologies in training of if our workers are able to manage them. For first time in history, there are 5 generators working side by side in the workplace. We have the traditionalists from 1945 to Gen Zeta, born after 1997. And now we are in the area of the internet, of the social media. Despite the percentage we can see on the slide that they seem so high, we have to take in account when the individual use social media for work is usually for the networking, to follow our contacts or to follow some business people. But I was asking myself, why not use this in our favor? Why not incorporate health and safety as a part of a trending topic issues? Why not engage through social media people between 45 until 64 years old in health and safety? This is one of the questions that we should do. We should ask ourselves and ask why don't is trending topic and fatal accidents a trending topic issue around the world. But what is not new? Coffee for all. Usually when we talk for training, we say coffee for all. We implemented training programs in our companies in the same way for everyone. But we have seen that there are 5 generations working together in our workplace. We cannot say working for all, but because we all want people well trained in health and safety. So we have to take in account when we do training for health and safety, the age and the digital skills. Because these are our training behaviors for the different generations. For example, the baby boomers, they prefer lectures and they enjoy reading books cover to cover. Gen X, they are the most independent generations and they prefer some lecture and small group activities. Millennials, they more inclined to Google information than look at it in a book. And Generation Zeta equate listening to lecture to torture because they want to be so active and engaged in their learning and not to be passive bystander. So they prefer digital textbooks. So when we talk About methodologies, what we're talking is about proposals and activities that are carried out with the aim of dynamic teaching and learning. Those who have children more or less under 20s, for sure, will be familiarized with these methodologies, due that they are now being used as new methodologies at the schools. We have thinking-based learning, project-based learning, gamification, design thinking, and problem-based learning. I will go through all these methodologies and trying to explain some examples that we are carrying out here in Spain. For example, thinking-based learning, the aim is not to store or memorize information. The methodology aims to motivate the student to take responsibility for his or her own education. And this is became more aware of its value and application for life. If we go through a example, we can see through real practice cases. That means that through real story about what has happened in the company, about work accidents, the workers should be able to analyze where are the fails and the points to improve. As empower of this activity, all the positive aspect that has been carried out despite the accident should be highlighted. And the end of this is that employees find out where was the error and what were the causes. When we talk about project-based learning, we encourage searching, choosing, discussing, applying, correcting, and rehearsing. We move something very important in health and safety. We move from learning is memorizing to learning is doing. And here I'm going to show you two examples. We have one example, it was carried out in a public hospital in Spain, and they have detected a high increase of the hands injury rate. So the health and safety department asked workers what to do and how to manage it to decrease this kind of injury. Workers design for themselves and with the help of the health and safety department and develop a project where causes and solutions for the hands injuries were developed, and where a specific training for all the new workers coming to work in the hospital, they can manage this training and be aware about the hands injury. After 1 year of the project, there was a 45% decrease of injuries. And that was really a success for the hospital because there was a totally project developed by the workers. Another project is about one that was carried out by a recognized luxury international hotel chains. It calls the Chambermaids project. The principal point of this project was to improve the ergonomy at the workplace. The first point that they do is that the chambermaids show to the health and safety department how they work in each aspect. For example, how they do the beds, how they clean the bathroom, how they clean the windows. So after they show to the health and safety department how they work, now all together, health and safety and the workers detected what are the hazards, what I'm doing wrong while I'm doing the bed, what I'm doing wrong when I clean the bathroom, what I'm doing wrong when I clean the window. After they together, the health safety department and the workers, they design a safety and health work method. And once this method is designed, they put in practice. That means that they plan for weeks. I mean, for example, they design a new method for how to do correctly a bed with no damage or musculoskeletal damage for the workers. So during 2 weeks, all the workers do the beds in the correct way. After they have managed and they have introducing themselves how to manage, how to do the bed correctly, they go to the other hazard. For example, how to manage my arms my elbows when I clean the windows. So after this project has been for the last 2 years, and this company has decreased their musculoskeletal disorders in the chambermaids workers for almost 60%. Another point we have is gamification. Gamification is learning involves using game-based elements such as point scoring, peer competition, teamwork, score tables, or to drive engagement. This will be help students to assimilate new information and test their knowledge. For example, there was a research from one of the oldest universities in Spain, the Universidad Complutense in Madrid. This research was carried out by the Department of Health and Safety in the master degree, and there was a research doing training for workers' representation on safety and health issues from the Andalusian public health care centers. We must say that in Spain, for law, all the workers' representation who wants to represent the workers in health and safety at least must have a training of 50 hours. So the Complutense University developed a research, and they established 3 models of training about e-learning. One without gamification. The model B was with plain tests and with some questionnaires with gamification, and model 3 was interactive content and gamification questionnaires. The representative sample was about 90 people. The results were so clear. Of course, the age was taken in account in this research, and the most important was that the model C, I mean the one with interactive content and gamification questionnaire, was the most that people like it, because that and the second part of this research shows that after 2 months of this training, the people who has made model 3 about interactive content and gamification questionnaire still remember all the training they got it, in difference with the other one that they have lost almost more than 60% of the training. About design thinking, and that was very important, that we are carrying out right now. It's design thinking is human-centered and leads to breakout innovations. Design thinking can help overcome yesterday working models and transform traditional organization cultures, because it's based in 6 main points: understand, observe, synthesize, ideate, prototype, and test. For that, we have an example that was implemented in the biggest company in Spain about water management, and they decided a program with the cleaning of sewers and drains, and which in this project, the practical term means identified with the help of the operators themselves all the risk points that may exist in their process of cleaning urban drains, and the corrective measures that should be applied to minimize accidents at work. After this developed project, there was new methodologies, not to training, but to apply the work methods, the process, how to work, improving not only the injuries, but always the well-being of the workers, and is decreasing the musculoskeletal orders. Another methodology that we have is problem-based learning. Students learn about a subject by working in groups to solve an open-end problem. This problem is what drives the motivation and the learning. Here you can see more or less the process. This problem-based learning is so important when we are talking if we find that we have a very high rate of injuries inside our workplace, and if we want to develop, we can do that. And I go so quickly: improving critical points, communications, and we have empathy and resilience, and we improve work team. We're using, of course, we have to measure this by smart objectives. The future, we have coming very quickly Generation Alpha in 2014. They are going to change work more frequently. They are going to be freelance. So if we want to then to be involved about health and safety, it will be not only problem of the companies, it will be a problem from education from the beginning, you know, from the kindergarten, manual law, teaching them postural hygiene to prevent musculoskeletal disorders. From the primary school, teaching them communication skills, how to solve problem-based learning and project management. From the secondary school, critical thinking skills, analyzing concepts. And from the EQF level, for example, working in process and safety and health. And we are carrying out in that child. In the next month, we are a new project taking account androidy and new skills for health and safety with Pomodoro technique, gamification, inverted pyramid, and behavioral safety system. And thank you very much. I speak so quickly, sorry for that. And if you have any question, please don't hesitate to contact me. Thank you.
Fantastic. Thank you, Mireia. Thank you for your presentation. What a fantastic set of speakers we had today, and what great insights. What we've heard so far really illustrates very well the innovation and flexible thinking that is already being demonstrated. Now, before we look at any of the questions received, and there's still time to post some of the questions in the Q&A box, I wanted to ask a question of my own to each of the three panelists. And that is, do you think that these new training methodologies could be applied in small to medium-sized enterprises? So, Mireia, if you don't mind, perhaps answering us first, your thoughts.
Okay, thank you, Marcel. Well, as you know, small and medium companies are, you know, the biggest problem about health and safety in the European Union, in not only European Union, I think around the world. So if we would really want to engage small and medium companies, even though those companies that they are in the productive sector, like plumbers or like electricians, you know, we need to involve the governments. We need to show the governments how important is health and safety training, the new methodologies, and to involve, you know, the bosses, the CEOs of this kind of company, and the young people is coming there. So more than make the training in, you know, in a private way, we should combine private and public sector just to be sure that all the small and medium companies are included in these new technologies and methodologies that we are taking in account for the training of health and safety.
Fantastic, thank you. Maybe Francesco, if you could maybe share your thoughts on SMEs, please.
Yes, thank you. And thank you, Mireia, for the very interesting presentation. Yes, of course, the small and medium companies have to be involved, can be involved. And as Mireia said, it's a public and private approach together is a very important thing. Another issue is that the big company have to enable and to force, I would say, their supplier to be certified and to be trained in the same way they use for their own operators. So I think that this is one of the mission we have to give to the big companies, even with the help of the public institution, to help the supply chain to be trained as for the inside operators, inside employees. So this can be really a mix of vision, and this was I was talking about stakeholders. Our supplier, our customers are our stakeholders, and this is common to everybody. So we have to put big companies, small and medium company, and the public institution all together to work all together to help who need more help to find a way to have a safer and healthier environment.
Fantastic, thank you. Rudolf, maybe if you can give us 1 minute of your insight.
Yes, of course, Marcel, and thank you very much, Mireia and Francesco. I would like to say a little bit about the Hungarian circumstances regarding small and medium enterprises. And in terms of occupational health and safety, they are sort of abandoned, and due to the incapability of the preventive measures and the authority checks, they are really relying upon their own skill sets, and it's very difficult to reach out to them and to let's say show them the best practices and what to apply in terms of occupational health and safety. What my experience is that even small enterprises working in high dangerous environment, and both working for multinational companies, they often are included in the multinational or big companies training programs, and sort of with that impact and this advantage they can use, they will be able to get and shift to the next level. So we are having real challenges in the small and medium enterprises. This is what I wanted to say.
Oh, fantastic, Rudolf. And before you go away, I'm just looking at the Q&A box and the limited time we've got left. There's one question that from Sona Atis saying that I've not seen PhD education on OHS on the list. Have you got any future plans for this, please?
No, actually, I must admit that particularly OHS PhD education does not exist as it is. But what we have is it's a safety PhD, and this is already since 2012, and the Óbuda University has this doctorate program. But this is broader. It's not limited to occupational health and safety. And what I know is that their aim is really technical scientists to train, and to able to solve real research and development tasks, and understand the complex safety and security. So we does have this. And actually it's a level 8 program. So I must say that, okay, it's not black and white, but we do have this doctorate program.
Ah, very good. And I think the next question, Mireja, is probably going to be the best position to answer this one. It's from Claudio Monforti, who says that new issues, example, focus on behavior, are clear. New tools are also clear. What is the new approach or trend in training OSH professionals to embed new cultures? So Mireja, maybe this is one you can help us with, please.
So if we want to, to improve OSH professionals, we really want to be part of the change of the culture of the companies, we have to improve first our communication skills. We have a big lack of communication skills. Our vocabulary is so technical. When we speak, always mention regulations, always law, and we have to do it in another way. If we want to blue collars, for example, workers understand us, we have to change our mode of communication. We have to forget books, manuals, and instructions. We have to be practical. We have to be on the field. We have to put our boots and helmets, and we cannot say we are talking about health and safety if we have never been on the field working hand by hand with the workers. So that's the main points of we have to do. And if we want to we have to emphasize with the workers. We have to realize then, or to show them how important is their life. And the main point and the main question I always ask to the people when I start any training: who is the people who most love you? If they answer their mother, if they answer my wife, if they answer my children, they are wrong. The first people you must love in your life is you.
Very true. Mireja, thank you very much. And thank you to all our great speakers for a fantastic session today. For any questions asked that we didn't get a chance to discuss, please keep your eyes on the ENSHPO LinkedIn page, where we will post any additional answers where possible. And also, just to let you all know, our next webinar is on the 26th of May focusing on psychosocial risks of smarter working. And we really hope to see you there. So thank you again, everyone, and goodbye.
Thank you very much for everyone. Rudolf and Francesco and Marcel.
Thank you, Marcel. Thank you, Francesco.
Thank you, Marcel. Thank you, Maria. Thank you, Rudolf. Thank you to all the listeners. Bye-bye.
Bye.